Thank you so much for being with us today. We have an amazing special program for you, and we are going to talk about our health. We know right now that our health depends in many factors, but we need to have some type of healthcare coverage. That way, if we have a problem like diabetes, high blood pressure, depression, or simply if we want to keep healthy, having an insurance can make a huge difference for us. Right now, you will start hearing a lot about something called redetermination. That's something that it's happening all over our country. And part of it, it's changing. And for that, we have an amazing special guest that is coming from all the way from LA Care. And today, we need to remember that our special topic is everything you need to know about medical renewal. And that special guest that we have, her name is Karla Romero. She's the director for Medical Product Management in LA Care Healthcare Plan. And she has been a lifelong study hard leader in our community. And most importantly, we want to hear what she has to say for us. And right now, Karla, how are you doing?
Hi, Dr. Shapiro. Thank you so much for that lovely introduction. I'm doing very well and excited to talk today about Medi-Cal redeterminations to let everybody know what that is and why it's important. So if okay, I'm going to provide a little context, or did you want to kick us off?
That will be amazing because, that's something that everybody's hearing about it, but I have heard that not a lot of people actually know what it is and if they need actually to put attention or not to it.
Yeah. So Medi-Cal redetermination is actually not a new process. It's a long-standing process, and it's an annual process that is done by the county. It's an annual process where the county checks to see who is and is not eligible for Medi-Cal anymore. But during the pandemic, right, the continuous coverage requirement was actually put in place. So during like the last 3 years, nobody had to go through the process. Nobody was required to go through their annual redetermination. And that continuous coverage requirement actually ended on March 31st. And at that point, on April, all the counties started the resumption of the Medi-Cal renewal process, and they began checking to see who is eligible for Medi-Cal and who is no longer eligible. But everybody has their own renewal month. So in April, the first beneficiaries that were impacted were those that had a June renewal month. And it's going to continue from April for the next 14 months. So this unwinding, as they're calling it, we're going to see happen through June of 2024. So between now and June of 2024, everyone should go through their annual Medi-Cal renewal process.
That's amazing. And one of the numbers that I have heard right now is that 15 to 17 million people in the US can be impacted from this. That's not a small number. And right now, from the past months, almost 1.3 million people have lost coverage to medical. And what are the common reasons that they are losing their coverage?
Yeah, that's a great question. I actually want to provide, I guess, more context from the LA Care perspective, right? For us specifically, we've been receiving data from the state. And in June alone, there were around 127,000 members that we knew received a Medi-Cal packet where they had to respond to and provide that information. Now, when you get that packet, it's very important that you provide that information that the county is requesting by the due date that's indicated on the packet. Because if you do not provide the information, then the county doesn't have what they need to determine if you're eligible or not. So if at the end of that, time frame by the due date, if they don't have what they are requesting, they actually disenroll you from Medi-Cal. So for some perspective, out of that 127,000 for June, we saw for LA Care around 38,000 beneficiaries that actually lost their coverage as a result of not returning their Medi-Cal renewal packet back to the county. And that's just for June.
I'm worried about that part because that meant that they actually were eligible to continue medical coverage. They fit perfectly that possibility of being covered, but because of something that it's mainly administrative, and I have heard a lot of the my patients that sometimes they got the package and they didn't sign it or didn't send it or they moved and they are not aware, why are they sending me this piece of Bible to my house, and why is this important for me, then it's impressive. Is there any message specifically for them of what things they need to do right now in order to actually help them on that path to being covered?
Yes. I would say there are some key messages that I definitely want to get across. And the first one is, if you have moved or if any of your information has changed, your phone number, your address, please make sure you're updating that information with the county. Individuals can do this several ways. They can go to benefitscal.com where they can update it in their existing account, or they can create a benefitscal.com account and update it that way. And they can access their Medi-Cal information that way as well. They can also call the county directly. They can go in person. They can submit changes, their packet information through the mail, but it's just very important that the county has their accurate information on file, because another thing is, if the county sends out the packet to the address they have on file and the beneficiary has moved, they're never going to get the packet, right? They're never going to know that the packet arrived and that they have something that they need to respond to. But I did want to point out one thing, Dr. Shapiro, from what you mentioned, which is, out of those individuals that get the packet, they're not necessarily all eligible. Some of them may not be eligible anymore, like legitimately may not be eligible. But there is a large portion of them who we believe are still eligible. And you're right, they're going to lose their coverage due to an administrative factor of not sending their information back to the county.
Karla, this is horrible. And let me tell you why, because a lot of them will end up knowing that they do not have healthcare coverage when they go for their insulin or their blood pressure medication, and they go to the pharmacy and go like, well, by the way, I need my medication. They go, yes, here's your medication, and this is the bill, and you need to pay cash. Or secondary, yes, they come to our clinics and they will go like, well, I need to see my doctor. Yeah, perfect. Come in. Well, this, that you do not have coverage right now, your medical labs. And they go like, what? Then that's the second one. But the one that I'm more and more afraid of, Karla, is when they end up having an emergency, they end up having cancer, like some horrible thing, and they end up on the hospital. And at the hospital, after surviving ER, they will go like, there's no healthcare coverage. Then that's why it's so important for me right now to have this conversation with you and the people from AltaMed and LA Care to make sure that we are making noise, and apart from making noise, making sure that we're giving the correct tools to our community. And Karla, what is LA Care right now doing to make sure that our community knows what to do or where to go?
Yeah, LA Care is doing, in my opinion, everything that we can to really get this message out there in the community. We've been pushing out member outreaches. We right now have a text message campaign that's going on. We have folks in our CRCs that are informed and educated about it, and community resource centers when I reference our CRCs. We've been doing provider trainings and pushing out provider toolkits. We're working with the Los Angeles County Office of Education. I really could go on and on about all the things that we are doing and conducting outreach, because this is such an important topic for LA Care. And we really want to make sure our members and all Medi-Cal beneficiaries are informed and know that this is happening, know that they need to update their information with the county. And if they receive a renewal packet, that they need to respond to it. So we've also been doing, specifically, we get that list. I think I mentioned this earlier, but we are receiving a list from the state that tells us these are all the folks that are expected and should have received a packet from the county. And we've been doing outbound a robocall campaign for those individuals to specifically try to target them to let them know, hey, make sure you fill out the information and send it back to the county by the requested due date.
Thank you for that, because that means that there's virtual things, and there's a possibility of actually going in person, because I have seen the package and it's not an easy package. There's like little things that actually we need to actually sign and do and correct, and information changes from like the past 3 years until now. Maybe we have moved, but I'm taking a couple of amazing messages, and correct me if I'm wrong. If we have right now, we need to make sure that our address is reflected in our insurance. That's the first one. You mentioned benefitscal.com to make sure that we have an account and go there and do that part, because sometimes actually that can save us a lot of headache. Also, you mentioned that if we need actually in-person help, we have these community places from LA Care that is actually helping with a lot of community health workers, people that are experts on this, to actually get the insurance and get the information to get the healthcare coverage if needed, or at least finish that paperwork that it's hard. And most importantly is our participation. As I say in Spanish, we need to pasar el chisme. We need to actually pass the word all over the country and all over the state and all over our families to make sure that nobody's actually, missing the opportunity to renew their insurance, and making sure that we're there with them. Is there anything else that I'm missing? Any other questions? Any other concerns? Anything that the community needs to know?
Well, a couple of things I really wanted to highlight that you touched on are community resource centers and the help that we're offering, because that, I think, is something that's amazing, right? If those packets can be a lot to kind of go through, and some folks it's really confusing. So if a member or a beneficiary does need help filling out their packet, understanding what they need to do, needs help submitting, they can actually go to our community resource centers and they can obtain help there. They can obtain assistance from someone there.
That's amazing, Karla. We're blessed to have you here. We're blessed to have LA Care, joining these efforts, and the stuff that LA Care has done for our AltaMed patients has been amazing, because you're creating that part of not just on the worst days of life, but also the preventive services, the making sure that our diabetes is actually controlled and we do not end up the ER, making sure that even the physician, nurses, and community health workers are there. And also, helping create a new wave of doctors, nurses that will serve our community. Then thank you so much for this message, Karla. And hope to see you soon. And we'll be in touch, because this is not over until 2024.
Yes. And I have one more message, Dr. Shapiro, if that's okay. For those individuals that did lose coverage, that have already received their notice of action being disenrolled, you still have time, right? They still have 90 days where they can send that information back to the county. And if the county determines that they are eligible, they will retroactively enroll them back to their renewal date that they should have been. So those folks that were disenrolled July 1st because they didn't submit information, if they submit it within 90 days and they're found to be eligible, the county will retroactively activate their eligibility back to July 1st. So I just want to make sure that's known, because they still have time. And thank you so much, Dr. Shapiro.
You're welcome, Karla. And if there's any other stuff, send us our way, because we need to kind of share with everybody else. Thank you so much. Familia. Well, you heard it right now from Karla from LA Care, the important part of being connected, the important part of doing everything. Then I'm going to leave you a couple of things right now. Make sure that you have these things. Make sure that your address is correct, that your phone number is correct, and your email address is correct. That way, the people from Medi-Cal can actually go and send you the information. Here's some other telephone numbers if you're in LA County, Orange County. And of course, if you're savvy with technology, you feel free to actually go to what we have there, benefitscal.com, and you can actually go there and fill out a lot of the information that you have. And of course, one of the crucial things that we have is sending the package back, signing it and sending it. Then if you have troubles, because sometimes we could have troubles, make sure that you can actually go to the CRCs, those community centers from LA Care that can give you one-on-one help. And of course, we are here also in AltaMed, that feel free to go to this website to help you out with everything that we need during this process. Then, familia, it's extremely important that we are all together, because we know that health is so important, and having healthcare coverage makes a huge difference for us and our families. And not only for us, but we are busy. We're doing a lot of things, and sometimes we just forget to take care of each other. Then don't forget about this, because this is crucial for all of us, because without health, it's very, very hard. to take care of ourselves and our families and our job. Then, familia, thank you so much for hearing us. I'm Dr. Ilan Shapiro here in Conversaciones Vitales de AltaMed in a special program with LA Care, making sure that we are taking care of each other. Thank you very much.